Okay, it is now 2 o'clock, so I'm going to convene the Kupuna Caucus meeting. Today's agenda is primarily, or all of, other than announcements, the presentation of bill proposals that have come into us or who are here to present. We will be taking and allowing a presentation, maybe brief, for each of the presenters. And at the end, we will list all of these bills, and online voting for the top 5 would take place next week on a Survey Monkey. So that will be sent out to all people who are members of the Kupuna Caucus, and you will have the opportunity to email your selections. And the link will be emailed to you. So if we don't have you, I suppose we have everybody's email, but make sure that you give us your email as well so you can vote on these proposals. We are limited to 5. So whatever you vote on, we will take the top 5 as the package for this Kupuna Caucus. Okay, so we will begin. Charles, how are we setting this up for people to present?
They can just raise their hand.
Okay, so raise your hand if you would like to present your proposal. Oh, Caroline, Gaderao, EOA.
Am I first?
You're first.
Oh my. Okay, I've been running from meeting to meeting. So thank you, Senator. Thank you,
Okay, thank
Representative Chun, for allowing us to. This is just an idea, a little project that we wanted to propose, and it's called the Medi Medi project, and it's really to build infrastructure. The purpose is to expand outreach to high-risk rural populations of older adults who may qualify for Medicare, Medicaid, Medicare Savings Program, Extra Help, and other low-income subsidy programs. And this would help to manage healthcare costs, alleviate long enrollment times, and we would assist with enrollment assistance to these programs to offset medical and prescription drug costs. And this is really for those on very low income that need help, and especially when they're trying to figure out, are we, do they decide to spread their medications out, or put food on the table, because they're really grappling with all these costs on a fixed income. And we're asking for this project some operating costs of $50,000 and also a 1 full-time equivalent to support this little project that we want to grow over time. And I'm available for any questions. Thank you.
Any questions of Caroline? So Caroline, the 60,000, is that for the 1 FTE, or are you?
Oh, the 50,000 would actually be operating, Senator, because a lot of these people, access is an issue, broadband is an issue. So we're going to need money for a lot of hard copy things to be mailed. And I mean, we can relook at that figure. It was just something that had come up, but kind of having some cost in there to put together all of those products.
So it's 60,000 or 50,000?
I'm sorry, 50.
50. Okay. And then, so 1 full-time equivalent is about how much? You're looking at a staff position, right?
Oh, well, that would be probably about 65,000, I think.
Okay.
I have to go back and look at the BHERD tables for bargaining unit 13. I don't have it off the top of my head. They're around there.
I think it's around 70,000, maybe.
Is it up there now? Okay, thank you.
So approximately 120,000 for this Mani Medi project.
Mhm.
Okay. Any questions? Any other questions? Okay, seeing none. So are you going to put something together for us? Or do you want to just write Mani Medi?
We have some stuff, so we can work on
Send
that.
it in so that we will have it for people to read
Got it.
before-
Mhm. Be happy to. Thank you.
Thank you. Anyone else? Greg, Ms. Sakian.
Thank you, Senator.
Thank you.
Aloha to everyone.
Uh-huh.
So the proposal that I have, and it is actually on behalf of Kupuna Council. So we are the organization that is an elder advocacy organization. Excuse me while I phone off. We've been around since 1972, so we do work closely with our state legislators. For those on the Zoom that don't know, the proposal that I'm resubmitting, again, this is going to be the second year. Technically, I think it's the third year, but the second year that we are going, hopefully through Senator Moriwaki's office, is for an ombudsman to help condominium associations throughout the state of Hawaii, where anyone who's living in a condo association can go to address concerns they have, whether it be with the governing documents not being followed, the statutes, which are within Hawaii Revised Statutes 514B, even state law, things that aren't being done where the association isn't complying and the owners feel they have no place to go other than go to court, which is very costly. That's what we've discovered through the analysis that we've done. So there's no actual money that we're asking for from the state. So this would be funded through the contributions that every condo association makes, and they're very small. It's just a few dollars per person. I think it's right now, I think it might be $1.50 per unit, and it might be a little bit more, but I'm not sure. I think that's around the number that I recall. So we're looking to, double that number, or even if we have to triple it. I'd be willing to pay $25 a year or $50 a year. That's minimal to have some kind of a place to go where I could get issues addressed. And just because it is close to heart, where I live, unfortunately, we have a lot of, and at the moment, corruption. We've got actually a stop work order that was violated 3 times, a DPP stop work order. So just to give you an example, and I am working with that agency, but we have board members that are behaving badly. They're actually violating the stop
I'm
work.
going to stop you there because
Yeah.
you're getting too much in the weeds.
No,
So
that's okay. I'll
condo-
summarize. Yeah.
Condo.
I'll summarize.
Condo.
So again, just to wrap it up, the ombudsman is basically a place that any condo owner can go to raise concerns that they would help to address and resolve those issues with some kind of a process that's mandated that the association has to go through, the registered associations throughout the state. And it's a place that we hope that we'll get some satisfaction, even when you have insurance concerns where there's been gross negligence for deferred maintenance on the property.
Thanks.
So
And you have a bill, or you have some language that you can send us that we could add to what people, this is very brief, that we could add so that people know what it's about.
Yeah, do I do that now in the chat
You
or for later?
can chat or later, whatever. But if it's just minimal, like, not a whole treatise, but so that people
Yeah, okay.
what you're looking for in the condo ombudsman.
Okay, thank you, Senator.
Thank you.
Thank you.
Thank you, Greg. Okay, anybody else? Raise your hand. Okay, Stanley Michaels.
Yes, thank you. Can you hear me all right? And aloha, everyone. Thank you so much. This is a follow-up to last year's HB 1772, referring to fall prevention. Just about everyone in this organization was kind enough to support this in somewhere other in the years past. And my name's Stan, and for 18 years, I was the Senior Fall Prevention Coordinator for the State Department of Health. That's the EMS IPSB. And even though I'm formally retired, I just can't stop fighting for this. We got all the way to the limit last year, and it passed everybody and signed everybody. And unfortunately, there wasn't any money, and they put a 2050 date on it. And I want to point out at this time that I'm now trying to go with a different direction. I want to point out that in 2014, state statute was created in Act 153. A fall prevention and early detection coordinator shall be established within the fall prevention and early detection branch. This was passed into law and signed by the governor. But what happened is that no one in leadership at the time followed through on it. It did not happen. The legislature asked to create a civil service position that would not be subject to the whims. It would be part of general funding, just like our suicide position is. It's generally funded. It was supposed to happen. It never happened. And I'm in the process right now of trying to make that happen. Everyone listening to this caucus is aware that it's only a millisecond for a fall to wipe out a family, especially if that fall occurs with a kupuna that's taking care of kids. All of a sudden now the family's got to find somebody to care not only for the kupuna, but for the kids. So falls are serious business and they're big money. The injuries are very severe. Everyone in this program has been so kind and supported. I can't tell you how grateful I am. But one of the things that's so concerned to me is that the fiscal support for the program is now subject to sort of the whims of leadership. And when leadership falls, and as it has in the last 8 years, it fell apart in our department and is now being corrected. The budget goes out the window and full support's needed. You all know through your testimony and stuff in the past that in 2014, 15, 16, when we were funded full, we led the nation in the least number of falls and the least number of injuries. It showed the program and the things that we were doing worked. We need to continue that. And so I don't know how, but I've tried and I've sent the information on to Deputy Director Debbie Morikawa, to see what to do about a create decision. I don't know how to do it. Nothing was done at that time to follow through, but we need to make it happen. We need so that it's always there. I see Dr. Fink, but I don't know if he's the correct one either. So if anyone hearing this knows what the next step should be, please jump in and help. I don't believe we should stop the existing bill, which seeks 100,000, thanks to Charles writing up and supporting that the 100,000 for fall prevention. I don't think we should stop that right now, especially if I'm trying to work in the background to try to get a civil service position running at the same time. I don't know any of the specifics. I just know that at 83, I can't stop. I can't let Kupuna continue to fall. And you people have been so incredible in the years past. I have nothing but the greatest respect and honor for your kindness in supporting all of our stuff in the past. But I'm running out of gas, so I need the assistance, and I'm seeking that through the other departments. If anybody knows how to get a civil service position going, please let me know.
So Stanley, do you have that bill from 2014?
I do.
It's an app, but
I
it's
absolutely do.
in a session law. So if the language is there, why don't you send it to us?
Okay, we'll do it. I've got it all. It's session 321-225-5.
Okay. Yeah, put it in the chat, or then we can follow up and look it up. Charles.
Okay. Well, thank you very much. I'll stop talking now. I'm just so grateful for all of your support in the past. Mahalo.
So if you're looking for just a question, you're looking for the position, and if that is something that can be done, then that other bill, that was last year's bill for 100,000, do you still want that? I mean, it's either.
Yes, ma'am, because I believe that
the
that's the level of support that we use for running the actual programs. The salary was built into the trauma fund. So, and that would stay the same with this civil service position. So we still need the support.
100,000 did not include a position.
Last year's was just supporting the program, correct? And this year, same thing. It's just to support the program and activities, not the position itself. That's fully funded through the Trauma Special Fund. But again, we need to make sure that it's reversed. We need a civil service position that absolutely is guaranteed, and then we can always seek to support money for the other years. Just want to protect so that the hard work that so many volunteers from the Fall Prevention Consortium, over 100 individuals, and many of the people in this room have made us successful in the years past. I don't want to let any of that work go to waste.
Okay,
Thank you so much, Senator. I will forward everything I have.
thank you.
Thank you.
Anyone else? Okay, roses. Rose S, you're on mute, I think. You have to unmute.
Sorry. Hello, can you hear me?
Now we can hear you. Rose. Oh, you're on mute again. Unmute yourself. You're on mute. Yeah, okay. Oh, no. Okay. Nope. Why does it keep on going back? You're on mute.
Okay,
Okay.
am I good now? I'm sorry about that. I'm not as uh anyway, this is my first time, and I would like to thank Rep. Cory Chan for inviting Local 1000 to join the Kupuna Caucus meetings. And yes, we submitted our bill proposal for next year. And the members of Local 1000 includes all the different homes, Type 1 ARCH, expanded care homes, the foster homes, and the developmental disability domiciliary homes. We had a little increase for our room and board this past year's legislation, but it's still not sufficient enough to continue opening our homes for our kupunas. In my proposal, I stated the amount, the breakdowns, and the bottom line figure that we're looking at for our room and board increase would be about 548 per client per month. And right now, the current SSI is about $943. And with this 548 that we're looking for, this would increase the cap ceiling to the state supplement to 1,332. And that would make our monthly room and board to 2,200. Of course, these amounts that I just mentioned includes the $75 PNA or personal allowance for our clients. We just had an increase, like what I said, but we just have to keep coming back to ask for more, Senator, because we really need that much money to keep operating our businesses. Thank you for this opportunity.
So did you send something in to us on your specific request?
Yes, I submitted it yesterday.
Okay. Okay, any questions? Okay, thank you very much, Rose.
Thank you, Senator.
Anyone next? Oh, Larry Smith.
Hello, everyone. It's Larry Smith. The reason I'm here as the chair of the Democratic Party Kupuna Caucus. And that is a group of a little over 2,000 people that are members of the Democratic Party that have expressed an interest in addressing and looking at seniors' issues. What we did this year is we sent out a survey to our 2,000 members, Google Sheet, asking them to prioritize what they thought the issue should be for the Kupuna. And so as to figure out where we need to put our emphasis. And then really the challenge would be to how we as the Democratic Party Kupuna Caucus coordinate with the members of the legislature and with your committee to see if we can bring these about. So the goal would be that some of the bills, when I go through them, some of them were bills that didn't pass last session that were valuable bills. So some of this would be if the sponsors could reintroduce the bills and we would then support them. And then there could be issues that are new issues, but someone in the legislature is already looking at this particular area. And if we could join with them to help support the bill. So so this is a little different. So, but I think, can I just very briefly, what we did is we ranked, and we just so happened to have 5 things. So this is the voting of the caucus of the 2,000 people. The first thing is, this is no news, is healthcare provider shortages. So what can we do to get more providers available, which would be looking at the mid-level practitioners and scope of practice and so forth. The second issue is kind of a new issue that impacts us all, which is the increase in the cost of housing and the cost of for homeowners. And so, a lot of that has to do currently with the increase in the cost of insurance, which was an issue in the last session, increase in cost of utilities. And so supporting any bills that would help seniors be able to continue to own their homes or own their condos. And for example, there was a bill, a Kupuna housing program, HB 648 from last year. We would like to have that reintroduced. So that's those housing, and really under the housing is the malpractice. I'm sorry, not malpractice, but the home insurance costs we have. Thirdly is home care regulations, support for more specialists that would be available to work in home care situations to improve the quality in those areas. The fourth thing would be improving the family leave caregiver support bill, which was, I believe it was HB 2757 or SD 2474 on the Senate side. Because what you're discovering, I've discovered this, is something called the sandwich generation. And it's a phenomenon where you have individuals who are now having to take care of their parents. At the same time, they're having to take care of their kids. And so these are individuals that have needs for support because they're supporting the generation before them and their kids. So the family leave bill would provide resources that would help people to take care of their kupuna in their home. So this benefit as part of a family leave bill would be very important to deal with the residents of the state that are having to deal with their kids and their grandparents. And the final thing, which is interesting, was a real concern about food security and the fact that seniors, like everyone, are having to deal with the higher cost of groceries. And these are ways to expand the SNAP program to include more segments of the population. So these were the 5 things that the Democratic Party Kupuna think are important. And so we want to work with you all to figure out how we can, hopefully there are already members of the legislature that have interest in these particular areas, and how we as the Democratic Party can help those legislators with the effort to get the bills passed. So I'm not sure how we're going to fit that into your survey or not, but we'll be glad to do it however you think would be most appropriate. But I think it's good to know, if you talk to 2,000 seniors in the state, this is where they are as far as what's important. And it's nothing new. So we know what the issues are. We just need to figure out how we can best help to address those issues.
Okay, any comments, any questions of Larry? Okay, so the way that we handled the bill proposals is that you come in with at least ideas for a bill. So issues that you have are big issues like healthcare provider shortage, or the cost of housing. But if there are bills that you say were not passed last session, if you could bring that forward to us, I think that's easier, because people are coming in with, this is a solution, or this is how we want to amend the current law, or something like that. So I know in terms of the cost of housing, you mentioned HB 648. And then for the family leave, Senate Bill 2474, we can certainly put that back up for people to look at. The others, in terms of healthcare provider shortage, I mean, that's kind of broad. I know we had some training bills from last time. I don't know if that meets your needs. And specialists in home care, again, broad, but you might want to provide us is at least some language of what you want to see the
Okay.
legislature do about it. And if you can get that to us, we can put it up there for people's consideration.
Yeah, we one of our volunteers, Barbara Penn, who really understands this, sent Charles an email a couple of days ago, and in the email it has the bill numbers.
Okay.
And so I think the easiest thing, and we can, Charles can really look at what we sent him, and if you take those bills, I think that would get us a long way to, if obviously we have because you have legislators that are interested because they introduced the bill, they supported the bill. For whatever reasons, the bill didn't get passed. So can we, instead of recreating the wheel, can we take those bills, work with the legislators if they're still wanting to support them, and how can we adapt the bills to get them passed? So that would be great. So if Charles could take those particular bills and we could say that the Democratic Kupuna Caucus supports the reintroduction of those bills for this Senate.
Yeah, and Larry, I do have
Yeah.
that list of bills that you sent me, so they can be included in the voting.
Okay.
Is that okay? Does that work?
Yep.
Thank you. I appreciate it.
So we'll put those bills up and people can read what the bills were and they can vote on that. And if that that rises to the top 5, then we will look at the bill a little bit more carefully in terms of any amendments that you propose, and we'll take it forward.
That's great. Thank you so much.
Thank you. Okay, anybody else? Raise your hand. Is that it?
Nicole Wu.
Oh, Nicole? Nicole, where's Nicole? I thought I saw her.
Hi there, Senator.
Okay, hi.
Hi, good to see you. Thanks for making this time to hear from us. I brought this to you last session, and as you know, that SB 2474 was a Kupuna Caucus bill. It's the paid leave bill. So I just wanted to reinforce what Larry was saying and offer a little bit more details about what a paid leave bill would have. I'm with Hawaii Children's Action Network. So we're a kids organization, but we are recognizing that, I'm actually in Gen X, which is sort of that sandwich generation that Larry's talking about. It's not just families with children, but it's also needing to care for our kupuna. So I had this problem before. Okay, it's not working.
No, we see it.
Oh, you did? Oh, okay. Okay, so quickly, paid family leave is a program that lets workers take time off and still get some of their income when they need to take care of themselves for something like a serious cancer or surgery, or if one of their family members has the same serious health needs. So that's where the Kupuna care comes in, or to bond with a new child. So these are some of the different types of leaves that other states have been including in their laws. Bonding for a new baby, caring for a family member. Active duty, many states have this, which is if a service member is being deployed, their spouse can take a few days off to deal with the arrangements that are needed for that deployment. Medical leave is to take care of your own serious illness if you're working. And then safe leave is the last one. And that's for victims of domestic violence, again, to get themselves to safeties and their children to safety, maybe go to court, something like that. We want to make sure they can take that time off and not be barred from taking the time off because they can't afford to. And again, that's in other states. So we're the only developed country that doesn't have paid family leave. I just made this bigger. At the very bottom on the right side, we are 0 weeks of paid family leave. The next second worst country is Mexico, and they have 12 weeks of paid leave. And you can see on the left side, you know, in parts of Europe, they get a year or two of paid leave off. Even in Canada, where most of my cousins live, they get a year off for paid family leave. So to fill that gap, 13 states and DC have passed paid family leave laws, and we really think Hawaii should join them. There's a lot of information, but basically most of our workers don't have paid family leave. There are some leaves that are unpaid. There's TDI when a woman gives birth, but no other kind of paid family leave at the state level here in Hawaii. The last bullet is from AARP. Hawaii has 154,000 unpaid caregivers, providing 144 million hours of unpaid care every year. And again, a lot of those folks are my generation, where we're just really struggling to take care of everything and pay our rent. So, you know, the expectation so far has just been to cobble together this care. And we don't think that's right. And we don't think anyone should have to choose between their loved ones and their paycheck. Lots of research shows all the ways it helps families, especially working moms, health outcomes, economic outcomes. Also, when women are getting this kind of paid family leave, they stay in the workforce, which, as I think we all know, helps them build up their Social Security so that it helps them in their retirement to have higher benefits. And for the state, we find that families with paid family leave don't need public benefits as much, so that saves the state money. The business community is coming around to realize that this also helps businesses. Lots of research has been done. California was the first state to have this more than 20 years ago, so lots of researchers have been looking at these other states. And businesses, their employees become more productive, there's less turnover. For small businesses, they can compete for the best workers because a lot of workers will go to a large employer with a better benefits package. But if we have a state-run program, then the small businesses can keep their best workers. They're not going to lose them to the big corporations. And similarly, it can help us keep some of our workers in Hawaii, because right now, all of the West Coast, California, Oregon, Washington, they have this. So it might be a factor in the decision if a young couple is thinking about starting a family, if they know they can get paid family leave in another state. And so we're looking for a program that would be run like Social Security or Medicare. It's small payroll deductions that go into a state fund. And then when the worker needs the paid leave, they apply to the fund to get paid. The key for this is that means their employers don't have to pay them when they're on their leave. So that helps the employers free up some funds for temp workers, or otherwise paying some other workers extra hours to cover the worker who goes out on leave. The way it is now, employers cover it themselves, workers struggle without pay. It's just a really difficult situation. So having the state-run program would actually help both workers and their employers. We did some studies here in Hawaii a few years ago with actuarial analyses and focus groups, and it's feasible. The payroll deductions actually would cover the cost for the state to administer it. So trying to follow all the best practices in other states. And yeah, last session, there's Representative Chen. We had a big campaign for this. We were so glad that the Kupuna Caucus adopted this as one of their priorities, and we really hope that you'll be able to do the same again. Okay, thank you.
Thank you. Any questions for Nicole? So Nicole, SB 2474 is the state-funded family leave?
It is. The HD1 version is even more detailed. We worked very closely with Labor Chair Rep. Mateoshi on the House side to really get into the details of Hawaii. So, you know, the HD1 is even more, I would say, more thought out than the initial bill that you put in at the beginning of session, because we spent a lot of time looking at that original bill and fleshing out all the details. And, you know, one thing about Hawaii is that we do have TDI. The HD1 for SB 2474 actually rolls TDI into a paid family leave program. So we'll get rid of the burden of TDI that's currently on employers, get rid of that cost. Instead, everybody would be in a larger paid leave program. So kind of helping employers out in that way as well. So the initial bill was good, but I think the HD1 is even more detailed and spells out exactly what we plan to do.
Okay, so when we put it up for people to vote on, we'll put the HD1, yeah.
That's great.
Yeah, that
Super.
would be great.
Thank you. Thank you, Nicole.
Okay, thank you. Next, oh, Audrey.
Yes, thank you very much. So AARP had put in the last bill that didn't pass last year, the caregiver tax credit, and we would like to have that bill reconsidered again by the Kupuna Caucus. And this bill provides unpaid family caregivers a tax credit up to about $5,000. And what it would do is help offset the kind of cost that they incur that's out of pocket. So the average cost for many of our caregivers paying out of their own pocket is about $7,200 a year. And so, and many times, many of our caregivers, especially for those who are taking care of an older family member, they have retired themselves or had to quit their jobs or are the sandwich generation. So they're burdened with the cost of caring for their children, likely a lot of college age students, as well as their parents or elder or grandparents. And so having this particular tax credit would be a tremendous relief. At least it would lessen their burden of paying out of their own pocket. So this bill, we have HB 1769, and that was the House bill version, and the SB on the Senate side, it was 2473. It really went pretty far until it got to the Senate Health and Human Services Committee, and where I think at that time we had all those various tax credit bills. And so along that period, it was pretty convoluted at that point. I believe the chair had decided to just push forward one of the tax credit bills. And so unfortunately, we didn't make it at that point, but we would really appreciate the reconsideration of this bill. And I could forward those two bills to Charles.
Yeah, so Audrey, you followed both of these bills, the House bill and the Senate bill. Is there one that's preferred? I'm sure the language is different in both the bills.
It's pretty similar on both sides, actually. I think by the time we got to the last part, they just took out the amount. So just so that it could go into, if it got to the WAM committee, it could then talk about, what would be the credit amount. So initially it started off at 5,000.
Okay, so the 5,000 is in what
I think it started off in the SB side. Well, it started off initially, and then it got taken out. So I think it was SB 2473.
We use the S 2473 with the 5,000, so people know what. Yeah.
Yeah. What was the amount? Yeah. Let me do it. Okay. Thank you.
Yeah.
Yeah. It's in the SB 2473.
Great. All right.
Thank you.
Thank you. Okay. Next, anyone else? Raise your hand if you have any proposals. Colby Chuck. Colby.
Hi, Senator Morlucky and Rep. Shah and everyone else for joining us. I am Colby Chalk with the Alzheimer's Association, and our proposal for this session is a standardized cognitive assessment or dementia screening at annual wellness visits for those over 65. Once you hit 65, they find that the risk of developing Alzheimer's is about 90% higher than the younger ages. So it would make sense to have a screening done at that point. And what really drove this policy forward is the fact that we have new treatments on the horizon that actually target the plaques that cause Alzheimer's. And this is really a big major breakthrough in dementia treatment and research, because previously it was you got dementia and it was kind of downhill from there. With the new treatments available, they work fairly well by really slowing down the progression of the disease by about 30 to 40%, depending on the drug and the demographics of the patient. But essentially, these drugs only work if the diagnosis is made early. And what we've been finding across a lot of our volunteers and other people that we serve is that the doctors, especially at the annual wellness visits covered by Medicare, they don't do a thorough screening, they just do an observation. And the observation isn't clear on what it is. So often the doctor might just look at someone and they might appear fine, when really, if we do a basic test that might take 2 to 3 minutes and can be administered by a nurse, not only the physician, it'll be so much more effective at catching earlier stages of the disease, allowing patients more access to possible treatments that could really help them and alter the outlook on their disease.
Wow, that's exciting to have new technology to slow down the Alzheimer's onset. So is this bill, do you have a screen, is it to start a screening program, or is it funding for screening? Or when you say standardize, it's already there and bringing it here? What exactly are you asking for it? Or do you have it in a bill that you sent to Charles?
So we outlined it in that form that we sent to Charles. We're working with Rep. Chun's office to have something drafted. But essentially what we're doing is we're saying at these annual wellness visits where Medicare covers it for those over 65, part of the visit, we're going to include a mandatory component that you have to be screened. That just takes 2 to 3 minutes. Again, it's non-invasive, but will really offer a lot more opportunities for those who might have the early signs of Alzheimer's.
Okay, great. Okay, so we have that, and then you're working with Rep. Chun, so that's great. Okay, so any questions of Kobe? All right, moving along. Anybody else with proposals? I don't see any hands going up. Any hands going up with proposals? Oh, Barbara Service. Thank you. Oh, unmute yourself, Barbara. Okay, great.
There were two other things on the muted again. Oh,
no.
Two other things that Pabia had mentioned, and I'm sorry I can't remember. I don't believe one of them was ever a bill, but the concern about disaster preparedness in condos for senior citizens. So some way to identify folks who need more help getting out in the event of a hurricane or whatever. I'm not sure if that was a bill or not. I need to look into that more. And then another thing was unemployment benefits for caregivers. Caregivers who are full-time caregivers cannot legally or legitimately say they're available for employment because they're not, because they have perhaps ongoing caregiver responsibilities. And again, I can't remember if that was a formal bill. I thought it was, but I would have to look it up and let you know.
Okay.
But those were two things that are on the Pabia maybe list that we wanted to make sure got on the Kupuna Caucus bill. And then the other things have been mentioned by others like Larry and Nicole and Stan and Audrey, etc. So
okay.
That's it. Thank you.
So you will find this, or if Caroline's on, to find if these were bills or not, and some language there that we can put on the list for people to vote on. Caroline, do you recall on whether the UI for caregivers and also the disaster preparedness to help seniors in condos get out?
I'm trying to recall the disaster preparedness. So Barbara, you're saying that's been introduced previously, correct?
No, I don't know that, Caroline. I'm not
Okay.
sure
I'm gonna have
about
to check,
those.
Senator. Yeah, I'm sorry.
Christina, do you know if those have been introduced?
It says that they were not billed.
Yeah, they were not bills. It was a proposal or an idea that was proposed during one of the legislative meetings, the idea regarding condos and disaster preparedness.
Okay.
It sounded like there was a need to clarify what exactly the issue was and what the suggested solution would be. And then also regarding the unemployment or changing the unemployment form for caregivers. I think that was a bill that Savvy Makalena was looking to introduce, but I don't think it ever got introduced. I'm not sure if she spoke to Senator Moriwaki, but I think she was thinking about it last session, but it never got into a bill. So both were never introduced as bills.
Could you follow up then in some language, and at least if we have the language and what it is, or if it's still in, being prepared or discussed, then that's one thing. But if you have some ideas and it's more gelled, then we could put the concept in and work, on the actual bill itself.
Okay, I'll follow up on that, Senator.
Okay,
Thank you.
Jack Lewin, Dr. Lewin.
Yes, hi. Thank you, Senator, and thank you, Representative Shun, for being here, you guys. Appreciate it. So one thing I just wanted to alert everybody to is the community of Manoa put together a kind of some sort of a strategy where seniors who would have issues during a disaster of any kind could be tracked by people in the community, and there was like a system that the community pulled together. So it wasn't just condos, but people who could be housebound or could be in danger in some way during a disaster, so that somebody was checking on all those people. So I think there have been some interesting community efforts in those regards. I just want to say that in terms of what SHPTA could propose for this coming year, we start working on ideas. We have a fellow in gerontology who has been working with a lot of different opinion leaders and movers and shakers across the long-term care scene in Hawaii with ideas, trying to come up with some pilot projects that might be really beneficial for us to propose. Some could be funded, in fact, by the payers who would benefit the most. So we'd want to market these to Kaiser and HMSA and Medicare Advantage providers, but others could be a benefit to us. We'll consider that. I also just want to mention that Judy Moore Peterson and I were delighted that we were one of originally 4 states, now 6 states, who have been accepted into the AHEAD grant.
Oh, great.
Which is a 10-year grant, and it's really millions of dollars, 12 million to the state for planning and actuarial and data analytics and that sort of thing. But it could be hundreds of millions to the community, doctors and hospitals who participate in the grant as it moves forward. It's a 2-year planning phase and then implementation. There will be, I think, many opportunities to improve home and community-based services and care for Kupuna built into the model as it evolves. So I want to make sure we continue to track those opportunities and incorporate people's thinking as to what the best models will be. So thank you.
Oh, congratulations. That's great news.
Yeah.
So at some point, maybe the Kupuna Caucus can hear from you as you proceed with your planning, and what might be something where you could get some input from members, and sort of your direction, in terms of getting the bigger amounts that we want coming into the state.
Exactly.
Okay.
Hala, we'll do that.
Thank you. Okay, anyone else? Raised hands? Well, we've got about 10 more minutes for you to think up anything if you don't have something. Caroline.
Senator, I think just for clarification that what they were speaking about earlier was the caregiver unemployment insurance.
Yeah.
And I may have missed what Christina said. I think that's what they were talking about, where they have to say that they're available to work, but they really aren't because they're caregiving, right? So Christina, was that the one?
Yeah, I didn't realize, I thought from what was shared during PABIA discussions, I thought that it hadn't gone to any legislation, but yes. So it came out of someone who's a caregiver who was caregiving for their mother who had dementia. She lost her job as a result because she had to take a lot of time away for caring for her mom. And when she went to apply for unemployment, it sounds like, you know, on the form, it asks you to check off, are you available to work? But as, you know, a caregiver who's caring for your mother who's ailing, the reality is she couldn't. And so it disqualified her to be able to receive unemployment. So the request is to be able to amend that form to consider caregivers and maybe adding something, some kind of language or verbiage that would ask, are you a caregiver? Are you caring for someone who's ailing, etc.? So
Yeah.
So a couple of things. One, whether you folks have talked to the unemployment insurance administrator, and she's very good and she could look up the law and whether this would be an exemption, you know, because you have to have worked in order to and be available to work to get unemployment insurance. But you know, maybe looking at
I called.
whether caregiver might be an exemption. Did you call Annie? Who said I called? Oh, I thought I heard.
I'm sorry, Audrey, that was me. I misspoke.
Barbara, did you call?
I mean, Sharon, I'm sorry.
You called the EY office? No.
No, I did not.
Okay. So I don't know if there's enough time, but it seems that would be a caregiver exemption so that you don't have to be available to work. But under the unemployment insurance law, you must be available to work. So, you know,
and that's what, yeah, Nicole just said that in the chat. Yeah.
But you know, it's something worth looking at because a lot of caregivers have worked a long time and to not get some support. But you know, again, it's a federal law, so looking at that might be something worth researching.
And I'd love to add that that's sort of where paid family leave would be coming in, right? Instead of trying to get them into unemployment insurance.
Yeah.
We would be taking care of the same caregivers and providing them with pay, but just with a different program.
Yeah, so I think, you know, what Nicole is saying is, you know, there's another pot of funding if we got the family paid leave funding to help support caregivers. But the UI one is a federal law, so it's kind of,
right.
You know, it's worth looking into and seeing whether there might be an exemption for caregiving. So we'll leave that open and then come back to us if you find anything, but we'll put it there, but with the caveat that, you know, this is a federal law.
Got it. Okay. Thank you.
Thank you. Okay, any more hands? And okay. Oh, there's one. Don Sand. Dr. Don Sand. Is it Sand? S-A-N-D, Sand. Don Sand. You're on. Unmute yourself. Okay.
Hello, Senator Morawaki. Thank you so much for being a part of that history-making SB 1035 that joined about 12 different coalitions to create a better financial environment for those physicians and dentists taking Medicaid. So to remove the GE tax was huge. So thank you for that. If you want a 3-minute summary on the state of the affairs of oral health, I think Cody explained one of the reasons why is we're finding the same plaque in untreated periodontal disease and dementia. So we know that untreated oral health disease in the Kupuna is affecting their cardiovascular, their mental health, and their cases like diabetic health. I wasn't prepared for a PowerPoint today, but if you have time for 3 minutes, I could give you an update on the 4 actions that the Hawaii Dental Hui has been taking this year.
Are you, planning to submit legislation, on, your dental plaque?
Yes, we as a group have worked for 3 years to be a part of reinstate adult Medicaid to improve the bills and to be involved with the SB 1035 Senator. But this year we have these 4 projects. They're providing direct care as pilot projects, demonstration projects. So we're not sure if we're just going to support bills or if we can hone down 10 initiatives to come up with 1 or 2 bills. But we'd love one to be the sugar tax. So a tax that would support medical and dental preventive studies, much like Dr. Lewin has. He has created funds to study and change the healthcare environment. We'd love to do that for oral health.
Okay, so the sugar tax bill and anything else, that you have that's legislation, because this, we're focusing on legislation for the upcoming session. But if you'd like to tell us about your initiatives on dental plaque and its impact, then we could certainly give you some time in the future to talk.
Sounds good. Sounds good. We could have a PowerPoint on that. And the closing thought is, I would think, we know how influential and powerful this Kupuna Council is, not only for Kupuna's healthcare, which we're interested in, but also I think that's the #1 concern that Kupuna have is for their keiki. So they're tied, and would love a future opportunity, Senator Moriwaki. Thank you.
Yeah, so if you'll let us know your email or send us an email on what your topic would be, and we could certainly put you on for a future meeting.
Sounds good. Thank you very much, Senator.
Okay, so just for clarification, you have a sugar tax bill, or that is in the discussion stages?
We do not, but we have 10 priorities that would all could affect the oral health care crisis for 280,000 residents, 2/3 that are Kupuna that are not receiving care. So of those 10, we have to create 3 priorities or 2, and we have not done that as a group. Most of us are practicing private practice.
Okay, well, we have a deadline because people are going to vote next week. So if you have any of these that are ready to go, we will accept them. Otherwise, you can present to us later when you have your time, and you probably will then have the bills available. You can discuss it with us. It won't be in our package, but we certainly can support anything that helps the health of our keiki and kupuna.
Awesome. Thank you, Senator Moriwaki.
Thank you. Okay, anybody else? We've got 1 minute. Okay, I don't see any more hands. So Charles, how many proposals do we have? Were you counting? I wrote it down, but I can't read my writing.
So 13 were submitted online, but then there's a few more that were directly emailed to me.
So,
So
okay.
that's the count that we have right now.
So we'll have approximately 15-ish proposals that will be put into a format, and Charles will send it to you with some description of the proposals, and you have the opportunity to vote on the ones that you, Charles, do they have 5 votes each, or do they just vote for, how do they
People
vote?
they vote for their top 5
Top
picks
5.
out of how many there are.
Yeah, so vote for the top 5, and then we'll see where it falls. And we will come back to you in December with some of the top 5, and then we can proceed with, then we will go and get the House and Senate bills drafted and ready for introduction in the next session. Any questions? Okay, thank you all very much for all your ideas, your proposals. We look forward to continuing our work together with you. And I bid you farewell. And where's my co-convener?
He's over there. He's there.
See,
Thank you.
Thank you,
Thank you
everybody.
both. Thank you both very much. We appreciate it.
okay, thank you all. Okay, have a good weekend. Bye-bye.
Bye.
Bye-bye.